Hi, my name is Lady Zambrano. I'm going to talk about primary sclerosis cholangitis.
The name primary sclerosing cholangitis, or PSC, is actually pretty straightforward. Primary refers to it not being known to have been caused by anything else. In other words, it isn't secondary to something else, right? Sclerosing means hardening of the tissue, and cholangitis is inflammation of the bile ducts. So with PSC, we have this fibrosis and inflammation of both the intra and extrahepatic ducts, so inside and outside the liver. As these cells around the bile ducts become inflamed, die, and harden due to fibrosis, you get this tightening of the ducts in some areas where there's been serious fibrosis, and then dilation in other areas that aren't as affected. And this leads to the classic PSC sign of this sort of beaded appearance of the bile ducts. These areas of fibrosis in the bile ducts can also be seen on histology and looks a bit like an onion skin, since you've got all these concentric rings of fibrosis around the bile duct. So sometimes it's referred to as onion skin fibrosis. Again, with PSC, we don't really know what causes it, right? One clue, though, is that it's been known to be associated with ulcerative colitis, which is an autoimmune disease, and Crohn's disease, which is an immune system-related disease.
It's a chronic liver disease that includes a progressive course of cholestasis with inflammation and fibrosis of the intrahepatic and extrahepatic bile ducts. The condition may lead to cirrhosis of the liver with portal hypertension and end-stage liver disease. Is associated with inflammatory bowel disease, mainly ulcerative colitis, and this often complicated by cholangiocarcinoma developed. Surveillance for colorectal cancer should therefore be strongly recommended in PSC patients with ulcerative colitis. Its symptoms are fatigue, itching, weight loss, yellow eyes and skin, and fever. The treatment is there is no cure or specific treatment for PSC, but you can take vitamin supplements, bile duct surgery, and endoscopy. The possible complications are bleeding, esophageal varices, cancer in the bile ducts, cirrhosis and liver failure, infection and biliary system, narrow and bile ducts, and vitamin deficits.
The next topic we're going to be talking about is primary sclerosis cholangitis. Now, this is different from primary biliary cirrhosis. In this case, you're getting destruction of the intrahepatic or the extrahepatic bile walls. Now, the problem is we don't know what causes this. It's a chronic condition. We really don't understand why these people are getting these strictures, right? So let's try to draw it out. If you look at this gallbladder here, the liver here, just gonna try to draw it out here again. Now it's the intrahepatic, but not just that. What it do develop is this